Hello, I'm Dr. Philip Blair, and I want to introduce you to beta-caryophyllene in your first dose. Now, this is a beta-caryophyllene BC+ liposomal challenge for your first dose to determine what your dosage should be and to identify the benefits. Now, before you take your first dose, I want you to perform a self-assessment of your symptom severity just prior to trial testing. Now, most users experience some of these benefits within 10 minutes of a sublingual dosing, but it may last for 6 to 12 hours. Now, first off, you may want to look at your pain level or your neurologic symptoms if you have a neuropathy. Second is your vision. You want to look at a distance objects, let's say out the window, look at branches, you could leaves, look at edges on different masonry. But anyway, you want to look at that and want to identify the detail that you see there. You want to look at the brightness. You want to look at colors. You want to look at clarity. Next, you want to look at your physical. You want to examine and assess your physical status in terms of relaxation of muscles and the range of motion of a specific joint. You can test that. You should expect to see some benefits in that particularly. Look at your energy, determine what energy level that you have right now. If you're exhausted after a tired day, you should see an energy increase within a few minutes. And then cognition, look at your mental clarity, think about your task orientation and your mental focus, as well as your visual focus. Now, think about your speech. Think about the rate of your speech, the content, the intonation that you have, and the loudness of your voice. That is a particular factor in the benefits that you can see with it. And you're looking at your mood particularly. There's feelings, typically there's feelings of well-being, there's laughter, there's relief of anxiety, depression. Just determine what your mood is right now and what it will be after the self-assessment in 10 minutes. And then sleep, you're not going to evaluate that right now, but you will be checking on it tonight after you take a dose. And we'll say more about that a little bit later, because beta-caryophyllene does not cause any drowsiness acutely, but it does help your sleep quality. So we'll be looking at that. Now, I want you to start with about a 0.5 milliliter or 15 drops and put it into a spoon or directly in your mouth. You swish it for 1 minute and then swallow. And then when I want you to carry on with your normal activities, wait 10 minutes, and then reassess your symptoms severity at that time. If you get adequate relief from pain, from anxiety, if you notice improvement in your mood, all these are positive effects, you're at the right dose. If you don't get a result, then you may want to double the dose. If you were taking a 0.5 milliliter, then you might want to go to a full milliliter. Well, take another 0.5 milliliter for a total of a full milliliter and check that within 10 minutes and do another self-assessment. Now, generally, I recommend taking the product twice a day because that seems to be the best combination, but you can take it more or you can take it less. It doesn't really matter because it's a natural substance. It's found in all kinds of herbs and foods, and it can be a major benefit for you. Now, it's best taken with a fatty food snack, an oil, or let's say butter or olive oil would maybe a teaspoon would be ideal for absorption because all cannabinoids are better absorbed with fats. Adjust the dose and your frequency to the optimal performance. I want your performance level to be optimized, and that's what I want you to adjust the dose for. Now, remember that basic beta-caryophyllene has no toxicity or known drug interactions. And the worst that you're going to feel if you take too much is a little bit of fatigue for a couple hours. Other than that, it's going to go away. Now, one of the things I want to mention about sleep is that it can be energizing. And with that energy, that can keep you awake for a period of time. So until you know if it's the right dose for you and how it affects your sleep, then you want to avoid going in recent getting it close to the bedtime and try by 2, 3 hours or even 4 hours. And you want to avoid that particular time until you know if it's going to affect your sleep. Well, good luck. I hope you do well, and I'm counting on it.